State Health Secretary Ram Kumar on Thursday informed that there are 5 COVID active cases in the state, acknowledging that COVID-19 cases have increased in the last few days, but the situation is not alarming. The health official informed that the government has taken precautions and the situation is under control. Kumar also urges the people to take preventive measures, especially in public places.
Meghalaya is very well we are prepared because in Meghalaya we are having a close look into the COVID cases. Today we have had 5 COVID cases, and tomorrow we are expecting a similar number or slightly higher number. But the most important point is that we need to always have a look into that in terms of our preventive aspect, because COVID is there with us. We have to learn how to be with COVID. It is also like any other disease. The most important thing we need to focus is that how much hospitalization has happened, how many severe cases are there. In that sense, it's not an alarming rate even at the rate of the national level. The cases are increasing. It could be a seasonal thing. If you remember, even in 3-4 months back also we had a slight increase for some time, then suddenly we decreased. We might have to see what is happening. In terms of preparation, we still have the COVID hospital which is there. As of now, we don't have any patients, but we have the COVID wards which were there in many hospitals can be immediately reactivated wherever this has to be required. So, and we have created a lot of additional isolation centers. We have the 100-bedded facility even in near the Ganesha's hospital, which is in Tura, it has been created. So we have enough facilities in that sense. We should not have any issues even in that case. But I don't personally think it will be of that situation, and I hope it will not be there. But we are taking, and our surveillance has been always on track, and we are checking whether these people are there. But as of now, it's not a big cause of concern. But we need to ensure that people with comorbidities or old age particularly, they are the ones who have to be more protected. That's something to be taken. Can you pause for a minute? I said we are having a look and close look into this. Maybe we will come up with a quick, after we'll have a state level meeting once, and then we'll check if there's any advisory to be issued and etc. Then we will come up with necessary advisory for the citizens so that it will be there. But speaking, always better to have slightly precautious behavior, because even in terms of flu seasons and etc., there are certain precautions which always has to be taken, and this is summer for us now, so those precautions to be taken would be always better to have a healthy this thing. But particularly my this request is that for people who are old age and comorbidities, trying to take a precautionary dose might be very, very helpful. So there are multiple vaccines available in the market. So we can take one of those options with the consent of their concerned doctors and etc. But that would be always a good choice to take care of those people who are susceptible to this COVID generally in terms of old age as well as comorbid population. Yes, if the situation comes where we have to immediately this thing etc., we have trained manpower everywhere in terms of handling the emergencies, severe etc. So we will always be in a position to engage with them. It should not be a problem at all. But as I hope and wish that it will not come to a situation like that, because our existing manpower are quite well trained to accommodate both the situations, and so that I don't see that to be a major issue. Not much. In fact, they're not coming in for testing, but it also depends. Until people are symptomatic, we don't expect them to test. The new protocol is also like that. We don't test them unless they're symptomatic. Asymptomatic cases are not even tested for. So only the symptomatic cases that are showing strong symptoms are the ones who are actually tested for, and otherwise they're not tested. So there is still a bit of stigma. I have not say that it is not there. There is still a bit of stigma of COVID and what happens with COVID and etc. But I just want to say that there is no stigma about it. It's like normal any other disease, and we just have to see what is to be and taken precautions. Medications are, to an extent, preventive and better medications are available now. Better treatment protocols are there, so we can be able to do a better job on that.